Hi, one of the important things about having epilepsy and thinking about getting married is the question, can I get married? Will it be okay for a person with epilepsy to get married and have children, and all the arrangements that we need to discuss? So, first of all, if you are a man and you are proposing to a woman and you're getting married and you have epilepsy, you should be very honest about your condition, share that before marriage and be open and honest, because that is a good foundation for a family, because it's very important to be clear from the beginning and not make any surprises in the future. I have one patient told me that, oh, I want to get married and then she will find out after we get married when I have a seizure. And that is not a good way to start a relationship. So first of all, just be honest. Second, you can invite your spouse or future spouse into a doctor's visit so that she can hear from the doctor and discuss all the questions that she might have in her brain and about epilepsy and seizures and what does it mean for a family. And the third thing is that it is very important, if you have epilepsy and you're very controlled in your medications, to continue taking your medications and discuss the treatment plan with your doctor. So here are the things that you should do. First of all, you should know that marriage is 100% compatible with epilepsy. So if you have epilepsy, it's like any chronic illness, like hypertension, diabetes. As long as you take your medications and you're good controlled, then that is not a problem to get married if you have epilepsy. And then on the other side, if you are a woman, so if you are a woman and you have epilepsy, you can 100% get married, start a family, have a life, all of that. You can take your medications and be controlled on your medications with epilepsy, and you can do everything you want. There is no restrictions to what the limit can be. Very important to also discuss with your potential spouse and husband about the diagnosis of epilepsy. Make them also see the doctor and discuss with them, and be open from the beginning, because it is very doable to get married with epilepsy. And the other thing, that if you're a woman and you're trying to get married with epilepsy, it is very important to discuss with your treating doctor the potential for pregnancy and delivery with epilepsy. And it is very important to know that some medications are okay with pregnancy and delivery, such as Lamictal and Keppra, and I discussed a whole video about pregnancy and delivery and epilepsy. And some medications are harmful for the fetus, such as valproic acid or Dipacot or Dipakine and topiramate or Topamax. So it's very important to be on the safe medications for pregnancy and epilepsy before getting married. And then the other question for both of you, if you are a man or a woman, you're getting married, the question about inheritance. Will you pass the epilepsy to your children? So we know that epilepsy in general is not a genetic disorder, even though some cases and some epilepsy syndromes can be strongly genetic. So for example, the general population of epilepsy, they have a risk of epilepsy is 1 to 2%. And if you have epilepsy yourself, the chances of you passing epilepsy to your children is on about between 2 to 4%. So in general, the risk of epilepsy passing to your children is very, very small. And having intimate life with your spouse does not cause seizures or worsen your seizures, but very important to make sure that you get enough sleep and not have like a long night without sleeping, because that can trigger your seizures. And make sure to take your medications every day, including your wedding day, in the morning and at night, so that you don't have any seizures triggered by excitement or stress during the wedding, and you make sure to take your medications on time all the time. And I'm sure that you have so many other questions about epilepsy treatment and diagnosis. And for this, I put one video that has all the answers for your questions in this video. And don't forget to subscribe so that you get all the new videos, and see you in the next one.